Welcome to the Deep Dive. This is where we take your questions, your sources, and really turn them into clear, empowering knowledge. Today, we're embarking on a journey, really, through a topic that's just full of anticipation, maybe some nerves, and, let's be honest, often a lot of unknowns. Hospital births.
Absolutely. It's a big one.
You asked for a comprehensive guide, and we've got this stack of materials here covering, well, everything from when do you typically give birth?
Yeah.
Right through to what is a C-section.
Yeah, lots to cover.
Our mission today isn't just about dumping facts on you, though. It's about slicing through all that information overload, hopefully sparking some aha moments, and leaving you feeling, truly prepared and confident. Ready to unpack this roadmap?
Let's dive in.
Okay, so let's kick things off with the big picture. Figuring out when your baby actually decides to make their grand entrance.
$1,000,000 question.
Right. So full-term pregnancy, generally that's considered anywhere between 37 and 42 weeks.
That 5-week window.
Yeah. And the average timing for birth typically falls around 40 weeks, measured from, the first day of your last menstrual period.
Or LMP, yeah.
Now, here's the fascinating twist, the thing that often surprises parents when they first hear it. That specific due date, the one circled on the calendar.
Yeah.
It's more of a statistical average than a precise appointment, like really.
Okay, so not set in stone.
Not at all. In reality, less than 5% of babies arrive on their exact due date.
Wow, only 5%. That's tiny.
It really is. That means you've got about a 95% chance it won't be that day. Most little ones pick a window, usually within 2 weeks before or after it.
Okay.
And it's pretty common, actually, for first-time parents to go a little past that 40-week mark.
That variability is such a key point, isn't it? For so many parents, that due date becomes this, fixed goal.
Totally.
What's one piece of advice you'd offer for managing those expectations around timing, knowing how flexible it really is?
Oh, that's a great question. I think the biggest takeaway is just embrace flexibility. Like, really, prepare for the due date, sure, but be mentally ready for that wider window.
Like a target zone, not a bullseye.
Exactly. Think of it as a goalpost, not a finish line. Sometimes, though, birth happens outside that ideal window. We call it preterm if it's before 37 weeks.
Right earlier than expected.
Yeah. What can cause that? Well, it could be spontaneous preterm labor, sometimes without a clear reason. Multiple pregnancies, like twins or triplets.
Makes sense.
Medical complications, things like preeclampsia, gestational diabetes, maybe issues with the placenta. Infections can play a role, or premature rupture of membranes because, you're water breaking too soon.
Okay.
And yeah, lifestyle factors too, things like smoking, really high stress, or maybe not getting enough prenatal care can contribute.
So a mix of medical and lifestyle possibilities there.
Definitely. And on the flip side, sometimes birth happens later. We call that postterm if it's after 42 weeks.
Going over.
Yeah. This can sometimes run in families, so maybe a genetic link. And it's also a bit more common with first pregnancies.
Interesting.
Because risks can slowly increase after 42 weeks. Think about the placenta aging, maybe reduced amniotic fluid. Most providers will start discussing options like induction, somewhere around 41 to 42 weeks, just to keep everyone safe.
Right, proactive management. What stands out here is how many different threads, both from your own body and your environment, can kind of weave together to influence when your baby arrives.
That's nice.
It really shows how much modern medical care has evolved to navigate and support all these variations. Knowing these broader timelines, it really helps you prepare not just for a birth, but for your specific, unique birth story.
Knowing those timelines definitely helps you breathe a little easier.
Yeah.
And so do some practical steps, right? Getting ready.
Sure.
Top of the list. Hospital tours. If you can possibly swing an in-person tour, it's highly recommended.
Oh, definitely. Seeing the space helps so much.
It really does. Lets you get a feel for the labor and delivery unit, see where you'll actually be, check out the room setup, the bed, any tubs or showers available, even where your partner might crash for a bit.
Yeah, the practical stuff.
And more importantly, it's your chance to ask those crucial questions. Think about what matters most to you. What are their visitor policies? What pain management options do they have, like epidurals?
And monitoring, continuous versus intermittent.
Good one. And breastfeeding support,
Yeah.
lactation consultants on staff. Asking this stuff can seriously dial down anxiety because you'll already know the environment.
Familiarity breeds calm, right?
Totally. And if you can't do a physical tour, many hospitals now offer really good virtual tours online. They're super helpful too.
Good alternative.
Another absolutely vital step, packing that hospital bag.
Yes, the famous hospital bag.
The sweet spot for getting this done is usually around 34 to 36 weeks.
Seems a bit early.
Well, you'd think, but labor sometimes loves to surprise us. And you definitely don't want to be scrambling when things start happening.
Good point.
So by 36, 37 weeks, have it ready by the door, maybe even in the car.
Okay. What goes in it?
Think in 3 categories. For the birthing parent, comfort is key. Comfy clothes for after, toiletries, phone charger, and pro tip, bring one with an extra long cord.
Oh, smart. Hospital outlets are never where you want them.
Never. Your ID, insurance card, your birth plan if you have one, nursing bras, slippers, basically things to make you feel human.
Got it. For mom, what about baby?
For baby, you actually need very little for the hospital stay itself. A couple of onesies, maybe a hat, a receiving blanket for the ride home, and critically, the car seat.
The absolute essential.
Cannot leave without it. Installed, ready to go, and don't forget your partner.
Right, they need stuff too.
Change your clothes, definitely some snacks. Hospital food isn't always great, or timely water bottle, maybe their own pillow. Comfort for them too. We'll link a full checklist in the deep dive notes, of course.
Perfect.
Okay, now let's tackle those early signs. Specifically, figuring out the difference between Braxton Hicks contractions and the real deal.
The is this it moment.
Exactly. So Braxton Hicks, often called practice contractions, they usually pop up in the 2nd or 3rd trimester, maybe more noticeable later on.
What do they feel like?
Usually like an irregular tightening, often just in the front of your belly. They're typically more uncomfortable than actually painful, and they're short, usually less than a minute.
Okay, irregular and short.
The key is their pattern, or lack thereof. They don't get closer together, stronger or longer over time, and they often ease up if you, say, change positions, drink some water, or just rest.
So they fizzle out.
Yeah. Their purpose, your body is basically doing warm-ups, toning the uterus for the main event, but they don't actually change your cervix. That's crucial.
Right. No cervical change.
True labor contractions, on the other hand, that's the main event. They signal baby is getting ready, usually in that 37 to 42-week window.
And these feel different.
Oh, yeah. Stronger, more painful, often start in your back and kind of wrap around to your belly. People often describe it as an intense building wave.
Okay, like a wave build.
And their pattern is the giveaway. They become longer, 30, 40, 60, even 70 seconds or more. They get stronger. And they get closer and closer together.
Consistent rhythm.
Exactly. And unlike Braxton Hicks, they won't go away if you move or rest. They gradually settle into this undeniable rhythm, their job. Actively dilate the cervix, open it up, and efface it, thin it out. Both essential steps to move baby down.
That distinction, especially the cervical change, is absolutely critical, isn't it? It's not just how they feel, but what they're actually doing.
Precisely.
Understanding that saves you so much guesswork and probably some unnecessary trips to the hospital too early.
Exactly. Which leads perfectly to that helpful rule of thumb many providers share, the 511 rule.
Ah, yes, 511.
Right. If your contractions are consistently coming every 5 minutes apart, lasting for 1 minute each, and this pattern has held steady for 1 full hour,
then it's probably time.
yeah, usually time to call your provider or start heading towards the hospital.
Good guideline to keep in mind.
So understanding the journey of labor means knowing it kind of unfolds in stages, chapters in a story almost. Before true labor fully kicks in, you might experience something called pre-labor or prodromal labor.
The warm-up act.
Kind of. Contractions here are irregular, maybe stronger than Braxton Hicks, but not yet causing significant cervical change. And they can sometimes linger for days, even weeks for some people.
Days or weeks.
Can happen. You might also notice some pelvic pressure, maybe a persistent backache, or you might see your mucus plug the bloody show.
Okay.
This phase, usually best managed at home. Rest, hydrate, gentle stretches, warm baths, keep moving. It's worth noting, though, not everyone has a long pre-labor. Some people jump right into the next stage.
Right, everyone's different.
Then we move into stage 1. This is all about cervical dilation, and it's broken down into phases. First is early labor, or the latent phase. Here, your cervix dilates from closed, 0, up to about 4 to 6 centimeters. Contractions are mild to moderate, maybe irregular at first, then slowly getting steady, lasting around 30 to 45 seconds every 5 to 20 minutes.
And this can take a while.
Oh, yeah. Hours to even a couple of days, especially if it's your first baby. You'll usually be at home for most of this part. Providers typically won't admit you yet unless you're high risk, your water's breaking, or contractions are already super strong.
Gotcha. Stay home and comfortable if possible.
Exactly. Next comes active labor. This is where the cervix dilates from about 6 up to 8 centimeters.
Things are ramping up.
Definitely. Contractions get stronger, longer, like 45 to 60 seconds, and closer together, maybe every 3 to 5 minutes. This is usually when you get admitted to the hospital.
Okay. And often when people ask for pain relief.
Very common time to consider options like an epidural, yeah. Then the final, most intense part of stage 1 is transition.
Transition. Sounds intense.
It is. Cervix dilates from 8 to the full 10 centimeters. Contractions are very powerful now, lasting 60 to 90 seconds. Maybe only 2 to 3 minutes apart.
Wow, close together.
Super close. This phase is often the shortest, but it's the most demanding. It can bring shaking, nausea, maybe feeling emotionally overwhelmed. It's tough, but means you're almost there.
That's a lot of numbers and stages to take in, but I think the key isn't memorizing every centimeter, right? It's understanding that each phase has a purpose, guiding your body and baby forward.
Absolutely.
What often surprises parents, especially first-timers, is just how long some of these stages can actually be.
Yeah, the early parts especially.
My best advice for navigating those longer phases, whether at home or even in early hospital time: focus on rest, stay hydrated, find comfort, nap if you can, listen to music, move your body if it feels good.
Great advice. That downtime is real. After full dilation, you move into stage 2, pushing and birth.
The pushing stage.
Yep. Starts when your cervix hits 10 centimeters, ends when your baby's delivered. Contractions stay strong, but often feel different now, usually accompanied by this intense, often really instinctive urge to bear down.
The urge to push.
Right. The length of this stage varies a lot. Could be a few minutes, could be a few hours. Birth positions, coaching, breathing, all really important here. And finally, stage 3. That's the delivery of the placenta. Usually happens within 5 to 30 minutes after baby arrives. Contractions lighten up, the placenta detaches and is delivered. And your body releases oxytocin, which helps the uterus contract and reduces bleeding.
If we connect this back, you can really see how labor is this beautifully orchestrated physiological process. Each stage has its job.
It's amazing, really.
Understanding these phases, it just empowers you to work with your body, Trust the process rather than feeling like it's just happening to you.
That understanding is so key, especially when making that big decision. When do we actually go to the hospital?
Right. The timing.
You should definitely go if you're having regular progressive contractions, especially if they fit that 5-1-1 pattern we talked about.
Okay.
For first-time parents, a common piece of advice is head in. When contractions are strong enough that you really can't talk through them anymore.
Good practical measure.
Yeah. And of course, if your water breaks,
Yeah.
big gush, or even just a steady trickle, most providers say head in right away, even without contractions, because the risk of infection goes up once the membranes rupture.
Makes sense. Bag of waters is broken. Time to go.
Any heavy bleeding also means go immediately. Light spotting, like that bloody show from the mucus plug, that can be normal, but heavy bleeding is different.
Okay. Know the difference.
And absolutely call your provider and go in for monitoring if you notice your baby's movements have significantly slowed down or stopped. Don't wait on that one.
Crucial check. Always trust your gut on movement.
Totally. Now, if you have specific medical conditions or high-risk factors, maybe a scheduled C-section, gestational diabetes, preeclampsia, your provider will give you very precise timing instructions. Might mean going in earlier.
Right. Follow doctor's orders if high risk.
And the week you're actually on matters too.
Yeah.
Before 37 weeks, any regular contractions, water breaking, bleeding, go immediately. Preterm labor needs quick evaluation.
Don't hesitate.
Between 37 and 41 weeks, that's the normal full-term window. Providers usually advise the 5-1-1 guideline, or sooner if you have risk factors.
Standard procedure.
After 41 or 42 weeks post-term, many providers will schedule an induction to reduce potential risks. So if you haven't gone into labor naturally by then, you'll likely be monitored closely or have an induction scheduled.
Okay.
So what does all this mean for your actual journey? Well, there's usually a totally normal gap between when those first contractions start and when you're actually admitted.
Right. You don't rush in at the first twinge.
Exactly. Providers prefer to admit you once you're properly in active labor. It's more efficient for the hospital, safer for you and baby, and honestly, usually more comfortable for you too. Less time just waiting around in the hospital during early labor.
Makes sense. Arrive when things are really moving along.
Right. So once you do arrive at the hospital, settle in. It's often a marathon, not a sprint.
Good mindset to have.
Your first stop is usually arrival and triage. Think of it like an ER, but just for pregnant people.
Okay. Assessment area.
Yeah. A nurse or midwife will quickly check your contraction timing, intensity, check your cervix for dilation and effacement, listen to the baby's heart rate, take your vitals, Standard stuff.
Check everything out.
And here's a decision point. If you're in very early labor, say, 2-3 centimeter dilated, mild contractions, they might actually send you home for a while.
Oh, really?
Or ask you to walk around the hospital until labor progresses more. But if you're in active labor, maybe 6+ centimeters, strong, regular contractions, they'll finalize admission paperwork and take you to a delivery room.
Okay, so triage determines if you stay or wait a bit longer.
Exactly. Once you're admitted to a labor room, you'll get a chance to go over your birth plan, if you brought one, with a nurse.
Good time to communicate preferences.
Yeah. Your partner or support person gets settled. You'll likely be hooked up to monitors. Could be continuous, could be intermittent, depends on your situation. There's usually some paperwork, insurance, consents, which staff will help you navigate, working around your contractions, obviously.
Right.
And here's a key insight. Early hospital time isn't all go time yet. You won't be actively pushing or giving birth the entire time you're there.
Right. Labor takes time. Lots of waiting.
Lots of waiting. Labor can last many hours, sometimes more than a day, especially for first-timers. So expect significant downtime between contractions.
What do people do during that time?
Good question. Music, podcasts, maybe short naps, if you can manage. It's often this rhythm of intense moments followed by long stretches of just waiting.
Prepare for the ebb and flow.
Definitely. Regarding the environment and comfort, food rules vary. Some hospitals allow clear liquids or light meals in early labor, but food is usually restricted once you're in active labor or if you get an epidural.
Good to know. Pack snacks for the partner.
Always. If you're mobile and don't have an epidural, you can use a bathroom. With an epidural, you'll likely need a catheter.
Okay.
Many hospitals encourage movement walking, bouncing on a birth ball, and showers or even soaking tubs might be available in early labor for pain relief. Worth asking about during the tour.
Yeah. Find out the options.
And absolutely bring a speaker or headphones. Music, podcasts, whatever helps you relax, distract yourself, or just create your own little bubble.
Create your own atmosphere. This really helps manage expectations, doesn't it? Knowing it's often a long process with phases of waiting and decision-making. That's where those comfort tools and your support people become just invaluable.
So true.
Thinking about it this way means you can prepare for that rhythm rather than expecting a nonstop sprint from arrival to baby.
Absolutely. Okay, once you've settled in, let's look at the main event. The actual delivery methods and the pain relief options.
The delivery itself.
You'll know it's truly time to deliver when your cervix is fully dilated 10 centimeters and completely effaced or thinned out.
Fully ready.
Yep. You'll likely feel those strong, regular contractions, but now they're coupled with this intense pressure in your pelvis or rectum, often described as an irresistible urge to bear down, kind of like needing to poop.
That powerful urge.
Your provider confirms full dilation, checks the baby's head descent, and gives the green light.
Okay. And the ways baby can arrive.
There are a few main methods of delivering the baby. Most common is an unassisted vaginal birth. Babies deliver through your pushing, no instruments needed.
The standard vaginal birth.
Right. Sometimes, though, an assisted vaginal delivery is needed. If baby needs a little extra help, maybe pushing has gone on a long time, or there's some fetal distress.
What kind of help?
Tools like forceps, they look like metal tongs, gently guide the baby's head, or a vacuum extraction, which uses a suction cup on the baby's head to help pull during contractions.
Okay, forceps or vacuum.
Then there's a cesarean section or C-section. That's the surgical delivery through incisions in your abdomen and uterus. Can be planned ahead of time or unplanned if things change during labor. Usually done with you awake but numb from anesthesia.
The surgical option.
Now, for positions for vaginal delivery, the traditional hospital position, lithotomy. That's lying on your back, feet often in stirrups.
The classic image.
Yeah. But many hospitals now actively support alternatives if it's safe and available. Things like side lying, squatting, maybe with a birthing bar, hands and knees, or semi-reclined.
More options now.
Often, yes. Upright or side positions can use gravity to help, and sometimes even reduce tearing. Worth discussing possibilities with your provider beforehand.
Good to know you might not have to be on your back.
For epidural and pain management, the epidural is probably the best known. It's regional anesthesia, given through a tiny catheter in your lower back.
Numbing from the waist down.
Pretty much. Blocks the pain signals, but keeps you awake and aware. You'll still likely feel pressure, maybe tightness, just not the sharp pain.
When can you get one?
Typically, once you're in active labor, maybe around 4 or 5 centimeters dilated. You can request it pretty late, but there's a point where it might be too late if the baby is literally about to be born.
Okay. How long does it last?
As long as the medication is running through the catheter,
Yeah.
it wears off usually within an hour or two after they stop it.
Got it. Are there other options besides epidurals?
Oh yeah, 5E medications, usually opioids, can take the edge off. Nitrous oxide laughing gas is another option some places offer. And then there's a whole range of non-medical techniques. Breathing exercises, hypnobirthing, water immersion if available, massage, movement, lots of tools in the toolbox.
Good to know there are choices.
Definitely. Now, let's dive a bit deeper into C-sections, just because they are pretty common.
Nearly 1 in 3 births, you said.
Yeah, in the U.S., it's a surgical delivery through incisions in the abdomen and uterus. They can be planned or elective scheduled ahead for reasons like a breech baby, placenta previa, maybe a repeat C-section.
Scheduled surgery.
Or they can be unplanned or urgent decided during labor if complications arise, like labor stalling out or the baby showing signs of distress.
Okay, planned or unplanned?
We could get into every single surgical step, but for this deep dive, let's focus on the key moments you'd experience.
What's it like for the parent?
You'll move to an operating room. Usually you get regional anesthesia, like a spinal or epidural, so you're awake but numb from the chest down. A sterile drape goes up across your chest.
So you don't see the surgery.
Right. You'll feel pressure, maybe some tugging, but not sharp pain as the baby is gently lifted out. And this part is often incredibly fast.
How fast?
The baby's often born within just 5 to 10 minutes of the first incision.
Wow, that is quick.
Yeah. After baby's born, they're usually handed to the pediatric team for quick checks. If everyone's doing well, skin-to-skin contact right there in the OR is often possible while they deliver the placenta and close the incisions.
Skin to skin is possible. That's great.
Often is, yeah. The whole surgery, start to finish, usually takes about 30 to 60 minutes.
Okay.
A really common question we get is, can the partner be there?
Yeah, that's important.
And the answer is almost always a resounding yes. Your partner usually sits right by your head, just on the other side of that drape. They can hold your hand, talk to you.
Be there for support.
Exactly. And they're often the first one to hold the baby after the initial checks. Exceptions are really rare, maybe only if general anesthesia is needed or in a true severe emergency.
Good to know they can usually be present.
Yeah. Recovery in the hospital after a C-section starts with about 1 to 2 hours in a dedicated recovery room for close monitoring.
What's that like?
Initially, you might feel a bit groggy, maybe shaky, definitely sore. Pain medication will be readily available. The catheter and IV usually stay in for the first 12 to 24 hours.
Okay.
And a C-section typically means a slightly longer hospital stay, usually 2 to 4 days, compared to a vaginal birth.
Makes sense. It's major surgery. This really helps manage expectations if a C-section becomes part of your birth story, you know?
Absolutely.
Knowing it's a safe, common option and that your partner can almost always be there, that can make what might feel very clinical actually much more personal and reassuring.
Totally agree. Okay, so baby has arrived. Now what? Immediate recovery in the hospital.
The first hours and days.
For the birth parent after a vaginal birth, you'll usually be encouraged to get up and move around within a few hours. Using the bathroom might be sore. They'll give you a peri bottle, like a little squirt bottle, for rinsing.
Okay. Movement encouraged.
After a C-section, you'll have that urinary catheter for maybe 12 to 24 hours. Then nurses will actively help you get up and walk slowly. Moving is super important for recovery.
Even after surgery.
Especially after surgery, helps prevent clots and gets things moving. Initially, you'll be on clear liquids, then gradually move to a soft, irregular diet once your digestion wakes up again.
Okay, gradual return to food.
For the baby, meanwhile, newborns sleep a lot, like 16 to 18 hours a day, but they'll wake up every 2 to 3 hours to feed. Like clockwork?
Sleep, eat, repeat.
Pretty much. Hospital care involves monitoring their vitals, weight, blood sugar. They'll get their first bath, a hearing test, sometimes vaccines like Hep B and vitamin K, plus eye ointment, standard newborn procedures.
All the initial checks.
And you'll have amazing support from hospital staff. Lactation consultants, IBCLCs, will likely visit to help with latch, supply, positioning, whatever you need for feeding.
That's huge support.
It really is. Nurses are your go-to for diapers, wipes, swaddling help. They'll also check on your recovery, bleeding, incision healing. And hospitals often provide a lot of supplies. Mesh underwear, giant pads, peri bottles, diapers, wipes, maybe even formula samples if you need them.
So you don't need to pack the entire nursery.
Definitely not. You really don't need to overpack your bag with baby essentials for the hospital stay itself.
Good tip.
Understanding mom's role versus partner's role during this time is pretty crucial too. The birth parent. Your job is recovery and feeding. Learning baby's cues, resting when you can.
Focus on healing and baby.
Right. The partner. They become the hands and feet. Changing diapers, swaddling, soothing baby so mom can rest, bringing food and water, talking to staff, asking questions. They're your advocate and support system.
Teamwork.
Totally. When it comes to eating and sleeping, the birth parent's diet is usually unrestricted after a vaginal birth. Gradual reintroduction after a C-section. Partners usually got to fend for themselves or rely on those packed snacks.
Right, partner meals usually aren't included.
And sleep. Expect short, interrupted naps for everyone. Baby feeds every few hours, plus staff checks. It's just the reality of those first couple of days. It's all about learning and stabilizing. Embrace the support.
Took 3 together.
Okay, you're nearing the finish line of the hospital stay. Let's talk about the road to discharge.
Going home.
Almost. Before you can leave, there are essential checks for both you and baby.
What do they check for mom?
For the birth parent, they need to see stable vitals, blood pressure, heart rate, bleeding under control. Any incision or perineal healing needs to look okay. You need to be mobile, able to walk short distances, use the bathroom independently.
Okay.
Yeah.
Functional recovery.
Pain should be manageable with oral meds. Bleeding should be decreasing. And they'll make sure a feeding plan for baby is in place. Plus, give you education on warning signs and postpartum care instructions.
Lots of checks. What about baby?
For the baby, a pediatrician has to give the all clear after a thorough physical exam. They'll have completed their tests. Newborn screening, hearing test, jaundice check, critical congenital heart disease screening.
Standard newborn tests done.
Important meds like vitamin K and eye ointment are usually given, plus Hep B vaccine if you consented. Baby needs to be feeding effectively, whether breast or bottle. And, critically, the car seat check.
Yes, the car seat.
Staff need to confirm you have a properly installed seat. It might even check that baby is positioned correctly in it before you wheel out. Safety first.
Absolutely.
For both of you, there's paperwork. Birth certificate registration, maybe Social Security form, insurance stuff. And you'll get a discharge teaching packet info on recovery, newborn care, warning signs, follow-up appointments.
The instruction manual?
Kind of.
Yeah.
So, how long do you stay? For an uncomplicated vaginal birth, usually 24 to 48 hours.
1 or 2 nights.
For a C-section, typically 2 to 4 days, depending on recovery. Stays can be longer if there are any complications for either of you.
Okay. And the bill. Do you pay before leaving?
Good question. Not usually, not right at discharge anyway. Most hospitals bill your insurance directly. You'll get a detailed bill in the mail later.
2.
You might need to provide insurance info up front, or maybe pay a copay or deposit, but you're generally not required to pay the whole thing in full just to be discharged.
Okay, that's reassuring.
Those final hours in the hospital, often a bit slower, more administrative, gives you time to rest, pack up your stuff, and mentally prepare for that first, very momentous ride home.
Deep breaths before the next chapter begins.
Exactly. So what does this all mean for you listening right now?
Yeah.
We've covered, well, everything from those first is this it contractions to the final discharge paperwork. And it seems pretty clear that the journey of a hospital birth is definitely a marathon, not a sprint.
For sure.
It's this really intricate blend of medical science, incredible personal endurance, and hopefully amazing support systems.
And if we connect this to the bigger picture, it really highlights something important. While the medical team manages all the clinical aspects, you and your partner, you are active, empowered participants.
Yeah.
You shape the experience through your preparation, your understanding, and by clearly advocating for yourselves. That's your power in this whole process.
Well said. What stands out to you, our listener, from this deep dive? Maybe it's the surprising fact that hardly anyone gives birth on their actual due date.
Yeah, that 5% number.
Or maybe a newfound appreciation for just how crucial your partner's role is during recovery. Or even just knowing about all that potential downtime in the hospital, which you can now actually plan for.
Little things that make a big difference.
As you prepare for this incredible chapter, just remember that knowledge isn't just power. It's also peace of mind.
Yeah, absolutely.
We really hope this deep dive into hospital birth has helped demystify the process, maybe ease some worries, and given you the confidence to approach this incredible moment with anticipation, not apprehension. What a journey.
Truly is.